Namaste dosto, welcome back to our channel. You did your MBBS and also did your residency, and you did very hard work to finish your post graduation and MBBS. In the due course, you have been taught how to fight or how to treat the patient illness, but you are not being taught how to do practical practice. Doing a medical practice is altogether different dimension. It is never taught in your course. So that's what the most of the doctors who come out, they find it very something like a burnout. The major reason why people feel burnout is they don't know how to do a medical practice rather than the patient load. So in this video, we'll see how actually we can handle the situation, how to develop the leadership qualities, how to use the technology to help yourself to do a medical practice. If you are feeling so, you're not alone. This is not uncommon. Most of the doctors who come out, they find this problem, how to start their medical practice. So in your course, you have been taught how to be just a cog in the wheel, not actually how to lead the medical practice. Developing the clinical skills is not equal to developing a good practice or developing a leadership skills. So to achieve all this, we need to have a different mindset, that is CEO mindset or leadership mindset. Today's healthcare expects you to be a good leader along with a business mindset and also possess a good amount of technological expertise. The roadmap to achieve this is first you should develop a business or a CEO mindset. With that, next one comes is mastering the leadership skills, and the third one is developing a technological or knowing more about the technology, how to implement in the your setup, and the last one and the most important one is financial or personal payoff. Embrace the CEO mindset. Stop being an employee in your clinic or hospital. You need to look beyond the patient because you are managing the show now. There are many things that have to be dealt along with the patient's treatment, and if you are a lone wolf who are fighting everything, you will not be able to scale and you will end up with burnout. Now you need to understand how to delegate your work to your staff and finding a right person for the right job. You need to get the people on board such a way that your show runs very well. Start asking questions like a CEO. To get a sustainable and scalable medical practice, you need to be a team player. You need to understand your team excellence is the way forward. If you want to focus more on yourself, you will not be able to do a good leadership job. Apart from this, you need to get some basics of revenue cycle management, financials, and accounting. Master the leadership skills. Leadership skill is not always inherited, it can be learned. Similarly, the emotional intelligence is also important. When you have high emotional intelligence, you always develop a good empathy. And this empathy will reduce your staff attrition rate. This is very important in any hospital. When you have high staff attrition, your medical practice or your hospital will suffer because you train your staff and they leave you and go. Leverage the technology is the right way. If you are still dependent on paperwork in your hospital, if you don't have a good HIMS, your hospital care will suffer because documentation, coding, billing, all can be automated with the help of the AI. This can lead to a reduce in your paperwork. This also will have an efficient workflow and your system will get benefited. So you need to have a good HIMS in your hospital. For example, our own NICE HMS, which is AI powered and ABDM triple milestone certified. There are other videos in this channel which you can go through to know more about this. Financial and personal payoffs. When you are using a HIMS in your medical practice, it can lead to a cost cutting. With a lesser number of the staff, you can have same work done more efficiently, and you can have a more profit, and also you can have more time for your patients, growth, and yourself. Let us recap: the CEO mindset, the leadership qualities, and also the third one is the technological expertise, and the fourth one is financial and personal payoffs. So these four steps can have a major impact on your medical practice and also prevent your burnout. That's all for today. This is Dr. Ramesh Bilagi signing off. Please do comment and subscribe to our channel. Thank you.